Hey everybody, it's Lauren here in the WeightWise Clinic. I have another video for you today for the pregnancy series that we're doing. And today I wanted to talk a little bit about nausea during your first trimester. Thankfully, I'm well into my second trimester, and my nausea and my energy level are starting to get back to normal. So if you're not quite there yet, cross your fingers, hold on, and hopefully that's around the corner for you. Um, but there's a lot of women, most women in fact, experience some level of nausea during their first trimester. And the reasons for this are really unclear. There's some research that link it to an increase in hormones during your pregnancy, progesterone and estrogen, and the pregnancy hormones all can play a factor in that, some research has said. Other research shows that, your stomach empties slower during pregnancy because of those hormones than at other times. And so while it's unclear, they do have some theories about why the nausea exists. But that's not really what I wanted to talk about. I really wanted to touch on some practical applications that you can do at home to try to help alleviate some of that nausea if you're experiencing that. These are things that helped me, the suggestions that came from my doctor, things that I've read in research. And so if you have anything to add to this, please send it our way so I can add that onto the list for you women out there experiencing that. First thing I would do would be to avoid strong smelling foods. Anything with a strong odor can make that nausea so much worse. I remember I was about 8 weeks along and I tried to make some deviled eggs to take to a potluck, and I thought I would lose my cookies when I brought out the vinegar to make the yolks for those deviled eggs. So strong smelling foods can make that nausea a lot worse. So doing things that don't have a strong odor, like Greek yogurt, can be a really good option for a small, very soothing meal or snack to go on your stomach. Second thing would be eat before you get out of bed. I know that sounds weird to eat in bed, but put something on your nightstand before you go to bed. I used these awesome pretzel twists. The package is backwards for you guys, sorry. But these are high protein, low carb, they're salty, they're crunchy, they're so easy on the stomach that you could eat just a few of those before you get out of bed in the morning. And that really does help settle your stomach because you're not up moving around and doing things before before you get something to eat. And so it does help settle the stomach in that way. Another thing that you could do is eat more often. I know here, especially if you are post-op from your bariatric surgery, we talk a lot about avoiding snacks. But at this point, eating about every 3 to 4 hours can really go a long way to knocking down that nausea and helping you tolerate foods a lot better. It doesn't have to be a full meal. In fact, I would encourage you to eat smaller amounts throughout the day, so it helps take care of that nausea more. Doing a few of these protein pretzel twists that we have at our e-store, or the protein pretzels, Greek yogurt, cheese sticks, a little bit of tuna, hard-boiled eggs, chicken, anything really good protein-based is going to be really good in small amounts throughout the day. So every 3 to 4 hours you can try to do that. Not drinking with your meals can go a long way as well. So trying to avoid, like you should be anyway, not drinking at the same time that you're eating can help that food settle a lot better in your stomach. The last thing, and this is more of a vitamin supplement, B6 has been shown to help with nausea in many pregnant women. And so if you wanted to add in a 25 milligram of B6, if you're not already taking one, then that can help alleviate some of that discomfort that you're feeling. That is something that I would clear with your obstetrician before you add it in. Just talk to them and see if a B6 supplement supplement would be good for you to kind of help combat some of that nausea. A lot of prenatal vitamins have a small amount of B6, and your bariatric vitamins for sure have an amount of B6 in there to help with that. It is a water-soluble vitamin, so it is something that is a non-toxic vitamin that you could take, and it should not be harmful for you. I hope these little practical tips do help you alleviate some of that nausea so you can finally get some relief. But like I said, if you have any other tips or anything that you've tried during your pregnancy, please send them in. I'll talk to you guys soon. Bye-bye.